Hello, everyone, and welcome to Milk Minutes. I'm your host, Program Manager of the Center for Urban Breastfeeding, Ashley Hall, and today we are recognizing October as SIDS Awareness Month, a time to elevate safe sleep education and remind families how small, consistent practices can make a big difference in keeping babies safe. I am excited today to be joined by Chastity Everett, our Health Education and Outreach Manager at Healthy Start. Chastity leads efforts to support families with health education, outreach, and resources that promote safe and healthy beginnings for every baby. In this episode, we'll talk about sudden infant death syndrome, often known as SIDS, what it is, how breastfeeding can lower the risk, and what families should know about co-sleeping, room sharing, and safe sleep practices. Together, we'll explore how awareness, education, and community support can protect our most vulnerable little ones. Welcome, Chastity. How are you today?
I'm doing well, and thank you so much for having me.
Absolutely. It's a joy to be with you, especially in this space, because oftentimes I'm learning so much about safe sleep and how we can help our families. And now this is an opportunity for you to share this with our viewers. Um, Before I jump right in, is there anything that you wanted to say? Did I miss anything in the introduction?
No, I think we're ready to just jump right into it.
Let's jump on in. All right,
Okay.
so what is SIDS and why is the awareness so important?
So SID stands for sudden infant death syndrome. And so that is a broad umbrella for babies who pass away under 1 year of age that remains unexplained even after thorough investigation. So the SIDS umbrella is just saying a baby passed away, they were under a year old. And so everything falls under that when the child is under a year old. Um, and so it's important because SIDS, many SIDS and sleep related deaths are preventable. And I think that's the biggest thing. So by following evidence-based safe sleep practices in Allegheny County, we can reduce SIDS. And so we can talk a little bit about what those are with your next questions.
Yeah. So you did say that they're preventable and there's a lot of things that we can do. And there's a lot of good information and trainings that are available for families.
Mhm.
And one of those training methods or ways to remember how to keep babies safe are the ABCs of safe sleep. Could you
Right.
share what are the ABCs?
So the ABCs are alone and on the baby's back and in a crib or a cribette. So a safe sleep related space. So alone, the baby should not sleep in the same bed as an adult with another person, and that's called bed sharing, as that increases the risk of suffocation or overlay. An overlay is when you could possibly roll over on the baby. Instead, a crib or bassinet should be in the same room. Room sharing is what it's called. On the back, it's called the supine. So the supine means that the baby is on the back. Position is safest for sleep, naps, and nighttime. So I want to stress that it's for naps as well, not just for night sleep. It reduces the risk of SIDS compared to side to stomach positions. Once the baby can roll both ways on their own, so the way you can decide if the baby's rolling both ways on their own is by having the baby do tummy time during wake hours so that you can view the baby and see the skills that the baby develop because babies develop so fast now. And so once the baby's able to roll from back to stomach, and you can verify that through tummy time, then the baby is fine. If the baby rolls in their sleep, they're fine to stay in that position that they choose. And you want the sleep space to be firm, flat surface. So you want it, the sleep space should be free of soft objects, pillows, quilts, bumpers, pads, stuffed animals, loose bedding, and nothing that could obstruct breathing. Avoid inclined surfaces, adults' beds, sofas, swings, or car seats. So babies should not be sleeping in car seats. If you're driving home from the grocery store, I'm not saying when your baby fall asleep, immediately pull over and you have to take your baby out the car seat. That is not the expectation. But once you get home, we do ask that you remove the baby from the car seat and put them in a safety approved sleep space.
That was a lot of good information, and just thinking about my own experiences. That first, the A, sleeping
Mhm.
alone. In theory, it sounds like yes, we want the baby to sleep alone, but new moms are often tired, and
Mhm.
you often fall asleep with the baby in your arms. And I know I did when I was a new mom too. In those moments, are there any suggestions that we may have for mom or family supports if they do notice mom nodding off while she's holding the baby?
So one thing that I say is get the most uncomfortable chair in your house. Walmart sells these little stools and they're very uncomfortable. They don't have a back to them, and I think they're like $9. If you sit on that stool to do your feeding, there's no way in the world that you would stay there all night. You would want to get up, put that baby back in their safety approved space. You don't want to do bottle feedings or breastfeedings, and I think we're going to talk about that too. You don't want to do that in the bed. So you don't want to think, oh, I'm just going to prop this pillow up and lean back and I'm going to let this baby suck on the bottle or suck, receive my breast milk, and I'm able to stay up and stay focused. Because as that baby is sucking on your breast and you're breastfeeding, it could become very relaxed for mom, especially if you're in
Mhm.
those stages of breastfeeding to where you're comfortable with baby, baby's comfortable with you, you have
Yeah.
your rhythm. And so it could be very relaxing to where it can put you to sleep. And so you want to make sure that you're in that very sitting straight up position or sitting in a chair that you know you don't want to stay in all night. And you're constantly probably moving around in the chair saying, man, I can't wait till I get out of this chair.
Yeah, not having any back support will definitely make
Yep.
you uncomfortable.
Yes, it, yes, it will.
Relying on sitting up straight while feeding a baby, I would imagine that that would keep you up. That is definitely a good suggestion. And then also, if we have family and friends who are around, we can always encourage them
Hmm.
to be a support and to, if
Yep.
we are nodding off, to remind us to put the baby somewhere alone where they're nice and safe. And now
Right.
you also mentioned lying on their back. That's the
Hmm.
B on that in that supine position and how important it is for babies who are unable to roll from right to left to lay on their back.
Right.
Yeah, and then you also mentioned in the space of their sleeping area that it shouldn't have any um, like stuffed animals, bedding, cushions. Everything should be firm and flat.
So everything should be firm and flat. And I think that a lot of people, years ago, probably around when my mom was having babies, they did have bumpers on cribs.
Hmm.
And the reason for the bumpers was because the space in between the bars in the crib was so wide that a baby could get caught with their head in between the bars. And so they invented bumpers to stop that from happening. But a lot of people continue to purchase the bumpers because they look nice, they look beautiful.
For the
One
aesthetic.
thing, yeah, right. And one thing that I say is on my bed, I have a ton of pillows and I have all these beautiful things. Before I go to bed at night, I push all that stuff on the floor just so that I'm able to sleep comfortably. So having that mindset, or if you just want to have the beautiful crib set up, take pictures and so people can see it, have it set up, but make sure that you have that safety approved sleep space where the baby actually sleeps.
Wonderful. And then just making those adjustments can truly save a baby's life.
Mhm.
Yeah.
Yes. And
Thank you
that's
so
the most important part. Yes.
Absolutely. We want to make sure that we're prioritizing their safety over our perceived comfort because
Right.
we don't need to have all the pillows and all the things for the baby to have a good night's rest.
Right.
All right. And then moving along, because you did touch a little bit on the breastfeeding and just out of curiosity, how does breastfeeding lower the risk of SIDS, or what are some information you have about breastfeeding and SIDS and the relation to it?
So here's what I want to make everyone aware of. When we talk about breastfeeding, you may hear some people refer to breastfeeding as human milk. Because in some parts of the world, they have to identify it as human milk because they have farms and all this stuff. So they call it human milk. And breastfeeding for at least 2 months may reduce the risk of SIDS nearly by half. So half is 50%. The protective effect in dose dependent, more human milk, which is also breast milk, long duration, confers greater protection, even partial human milk. So if you don't, or if you can't breastfeed all the time, at least breastfeeding or using breast milk some of the time. There are also organizations in Allegheny County that have donation breast milk. So if you, for whatever reason, can't use your own, you can get donated breast milk to feed your baby, and they test it and they make sure that it's safe. Breastfeeding is also associated with reduced overall infant mortality beyond just SIDS. Human milk supports immune function and protects against infections like respiratory infections, which may reduce stress and vulnerability that may increase SID risk. Breastfed infants might be more easily aroused from sleep. And so, if you can picture yourself, breast milk, if you ever see it, when you're feeding your baby or you put it in a bottle, it doesn't look really heavy. So, it's almost like if we go out ourselves and we go to a sushi bar, which my daughter took me to, and we eat sushi. we feel full, but we don't feel sluggish. Like we can still move throughout our day. And so that's how I view breast milk. It's giving us the baby everything that they need. They're not hungry. And so if they get into a compromising position, they'll wake up and they'll cry. Where if you go to a steakhouse or if you go to a buffet and you eat heavier food, you're going to sleep heavier. And that's the same for the baby. So bottle feeding a baby formula is a lot thicker than breast milk. And so it'll cause the baby to sleep a lot longer, which will cause the baby sometimes not to wake up in those compromising positions.
I see. Thank you. That does bring a lot of insight, and I really enjoy the comparison between the sushi and the steakhouse, where
Mm-hmm,
you're not going to be, you won't have the itis, but you'll be able to wake up if you are,
mm-hmm,
if the baby is laying in a position that may compromise their breathing pathways, that they'll be able to alert mom through
mm-hmm.
crying and letting her know.
Right.
Okay, that's a wonderful comparison. I really appreciate that. And then also, like you mentioned too, there's so many health benefits that go beyond
Mm-hmm,
just the first line of just SIDS. Breastfeeding can save a baby's life in so many different ways. You talked about
mm-hmm,
their stomachs, their respiratory development, them having the antibodies and all the things
mm-hmm.
that will keep them healthy through that first year of life.
Right.
Absolutely. And we're moving through these questions fairly quickly.
Okay.
What should families know about co-sleeping and room sharing? We touched a little bit on it, but could we break that down a little more?
So the American Academy of Pediatrics, also known as AAP, and so through this, I'm going to give you the name of something, and I'm going to give you the abbreviations because sometimes when people are speaking, especially if you're in that health environment, they just say, "Oh, follow the AAP guidelines," and you may say,
Hmm.
"Who's AAP?"
Right, right,
So
right.
AAP is the American Academy of Pediatrics, and other safe sleep guidelines recommend that infants sleep in the same room as their parents, but on separate sleep spaces. So it's important to have that baby at those beginning, when you first bring the baby home, at least up until the baby's a year old, to be in the same room with you. And if you can't do it for a year, at least try to do it up to 6 months. Room sharing is associated with the reduced risk of SIDS. Some estimates suggest much as 50%. So if you're hearing everything that I'm talking about is 50%, 50%. So if you continue to do everything, you will be at almost 200%, which means that your baby has a very likelihood of not being compromised by an unslaved sleep space.
Yeah.
Um, the proximity allows for monitoring, feeding, and responsiveness during the night without hazard of bedding. The sleep surface should be safe and free of hazard, even in the parent's room. So just because the baby is sleeping in a room with you, next to the bed with you, doesn't mean that you can have stuffed animals or pillows or blankets. You still want to use a sleep sack if necessary. You want to make sure that the temperature of the room is appropriate for a sleep sack. So you've carried your baby for 9 months. So whatever temperature your house is in, your baby has adapted to that temperature unless you changed it. So the baby has adapted to the temperature. So if you're sleeping in pajama shorts and a pajama shirt, you don't want to put your baby on a whole sleep sack, a wool sleep sack that zips up because the baby can possibly overheat. Bed sharing is associated with increased risk of SIDS. We talked about that. Ensuring the mattress is firm and free of soft bedding. We talked about that. And one thing that we want to make sure is ensure the adult is sober. One thing that I want everybody to keep in mind through your 9 months of pregnancy, I'm sure nobody was drinking wine or partying, but if you are not drinking for 9 straight months and then you bring the baby home, you have a small celebration, and your normal amount that you would drink, maybe 2 to 3 glasses, that will not be your normal when you come out of your pregnancy. So you need to gauge what that is because it may be a half a glass and you feel a little woozy. So making sure if you are going to drink that you have a support system, you have someone who can keep the baby for you. A great organization is Jeremiah's Place, and that's located in East Liberty at the Kingsley Center. So if you were to sign your child up for Jeremiah's Place and you wanted to have a night of relaxation, you can take the child to Jeremiah's Place. You don't have to take diapers. You don't have to take formula unless you're breastfeeding, and they will keep your child. You just have to register, and you can do that online. Ensuring that you're not smoking. And if you are smoking, that you're putting on an overcoat or a sweatshirt, that you're smoking outside. Before you, when you come back in the home, you're removing the overcoat or the sweatshirt, you're washing your hands and rinsing your mouth. Because if you don't wash your hands and rinse your mouth, when you go to kiss your baby, which is probably the first thing you'll do when you see your baby again, the baby's going to breathe in your whole Newport. You don't want your baby to do that. That's not a good
No.
thing. And so, and you want to make sure that if you're on medications, again, if you're on any type of medication, if your doctor gave you a painkiller, maybe you had a C-section and you're on a painkiller and you're taking that, just making sure you identify supports, because right after you have a baby, your body needs to build back up to its original capacity of being able to deal with things, and you don't know what that looks like first coming home. So just make sure you have the supports in place.
Absolutely. That was so much valuable information. Just go backpedaling a little bit. I did have a question. Some viewers may not know, what is the sleep sack?
So the sleep sack, it looks like a blanket. You can get it really thin or you can get it thicker, and it zips up to where it can't go over the baby's head. So it
Hmm.
zips up until it comes to about the baby's neck, so to about here, and their arms are free. Their legs aren't as free, but you can unzip the bottom if they're a kicker, because some babies don't like to be restricted. So if they're a
Right.
kicker, you can unzip the bottom, but it just protects them from anything being able to move over their face.
Thank you. Thank you so much.
Mhm,
That is something newer too. My daughter, when I brought her home, we didn't have sleep sacks, but there
mhm,
was definitely times where I kept checking to make sure that the blanket wasn't covering her face or blocking her airway. So it's nice that we do have those available,
mhm.
and yeah, that moms can utilize those to keep babies safe.
Right. And if you need a sleep sack or a pack and play, you can reach out either while you're going to your prenatal visits. You can talk to your clinic. And a lot of the clinics with UPMC have those in the
Mhm.
clinics that you can get them. And they also have sleep sacks. So you can request that. Or when you give birth to your baby at the hospital, they definitely will have it in that setting. And I don't want you to feel like, or anyone to feel like, asking about that will put you in harm's way of them thinking that you're not able to care for your baby. If anything, it's going to do the complete opposite and let them know that, hey, I'm really concerned and I need some support and help.
Absolutely. Thank you so much. And my last My last question, because I
Okay.
can keep talking and keep asking. There's so much good information, but just being mindful of time. What role does community education play in keeping babies safe?
So, community education is a crucial pillar in reducing sleep related infant deaths. There are several roles that the community can play, and I'm going to give you what those are. So, one of the most important roles is raising an awareness and knowledge among caregivers. So, if your grandparents or your sister is caring for your baby, that you make sure that you let them know, hey, when my baby's with you, this is the way that we allow this child to sleep. They sleep in a space that's alone on their back and in a crib. Normalizing safe sleep practices and misinformation. And so a lot of people, especially if your grandparents or great grandparents are watching your baby, a lot of things you may hear is, well, I watched your mom and she slept in a bed with me and she's fine.
Right,
Well, things have changed. People are sleeping harder. If you notice, when you go out to dinner now, normally you would go out to dinner and you're like, okay, let's go get some ice cream. Now, when you go out to dinner, you feel sluggish, you feel heavy, and you want to go home and rest. And normally that's a really deep sleep that you go into. So our food has changed over the years, which impacts how hard we sleep and how much we move in our sleep. Linking family to resources. So, like I said, we talked about Jeremiah's place. Healthy Start, the Center for Urban Breastfeeding, which is where we are now. The Cub is also known as the Cub. We have our home visiting program, which can support you and come into the home and help you with baby development and help you understand some of the things that may be going on with you. We have our doula program that we can have someone come to the hospital with you and to your prenatal visits to support you with understanding what is going on with your pregnancy, to give you a birth plan on what you want your delivery to look like. And we also have Moving Beyond Depression. And a lot of people, when they have their baby, they go through what's called postpartum depression. And postpartum depression sort of kind of makes you feel like you're in a slump. You know, you don't want to do the things you used to do. And we have a clinician, well, we have several clinicians that can come to your home and help you and work with you in supporting that. And one of the programs that I love a lot is our Fatherhood Initiative program, which means if the father of your child or if the other parent of your child wants to be a part of the program, they can also sign up. So we are not just looking at the one parent. You can both come in and get the support from Healthy Start. So community resources are great, providing training and policy change. So really, talking to policymakers and policy changers about the importance of sleep related deaths. And hopefully, at some point, sleep related deaths will have its own category and not just be under the umbrella of SIDS, but have its own category in identifying that this is something that is happening heavy and we need to really do a lot of research in it. Creating accountability and evaluation. So just being able to say what happened, how can we make it better, how can we support, and reducing disparities. We notice that normally babies who are born in lower neighborhoods with lower income, with lower education level, those are the babies that we're losing. And so, how do we connect with those people in the communities who don't have everything that other communities may have? And what Healthy Start has decided to do that is we have launched a Safe Sleep Community Task Force. So that task force is strictly community driven. So we want you to come to the table and tell us what you think. If you slept with your baby for the whole first 3 years, we want you to come to the table and share that story. If you were cautious of sleeping with your baby, we want you to come and share that story. If you did both, we want you to come and share that story. If you're a grandparent, a great grandparent, we want you to come share your stories of when you raised your kids and share and talk about how do you think the different ways are impacting people today. We want everyone to come together and have a conversation about best practices, if the material we're putting out is impactful for everyone, and how the community wants this information to look, because we can draft it the way we want it to look. But
Right.
if you're not receiving it, we want it to look the way you want it to look so that you can actually receive the information.
Absolutely. And when did this begin? When can they sign up? What's the timeline?
So they can sign up for the Safe Sleep Task Force immediately.
Excellent.
We are accepting signups until October 20th. That
Okay.
may be extended depending on how many people sign up. We will have our first Safe Sleep Community Task Force meeting October 29th. That is a virtual meeting, so you don't have to leave home. You don't have to turn your camera on. We don't call you out. You say what you want to say if you want to say something, or if you don't want to say anything at all, but just be in a space, you can do that as well. We'll also be hosting town halls that you can attend in person if you would like to or choose to. We just want people to show up and be in this space.
Excellent. That is such a wonderful opportunity. Everyone's voices do matter, and we want to
Mhm.
make sure that you guys all show up. So use the QR code and please sign up and look out for more information about our Safe Sleep Task Force. And I really want to take the time to just thank you, Chastity. You gave us so much valuable information. It was so informative, and I really appreciate you taking that time out your day to share this information with our viewers. And also, if you are a pregnant Black mom in Allegheny County and you are looking for breastfeeding support, please reach out to us via our latch line at 412-545-2022, option one, and you will receive help from a Black lactation professional in Allegheny County. Thank you for tuning in, everyone, and enjoy the rest of your day.
Okay,
Thank
thank you.
you. Bye.